So there are several options for incisions to perform a breast aug. The incision underneath the breast, or the IMF incision, is the most common. There's also a choice to have an incision around the nipple called a peri-areolar, and then there's also a possibility of getting an incision up in the axilla or in the armpit. There are other described methods of introducing implants. One of them is called the tuba method, which is a transumbilical, meaning they actually go through the belly button, tunnel up, and then go underneath there. It's a pretty uncommon access point for breast augments. The reason why it's very rare is it's blind, so you can't actually see what you're doing, and it's all by feel. So the issue there is potentially you can have a lot of bleeding, and you can have various other things. It's also a saline implant that goes in, so it's a small deflated saline implant that goes in that is reconstituted with saline. Very uncommon, very few people do it. Tends to be very unreliable. So the most common way of doing it is an IMF incision, or incision along the breast crease or the breast fold. That incision is the best way to control the lower fold of the breast. It tends to be an area where there's fewer bacteria, and so we can sterilize it and keep that area a lot more clean during the implant insertion. We can see the whole pocket quite easily, both the medial pocket, lateral pocket, all the nerves, everything else. And it's a scar that hides very well around the breast. Peri-areolar is a method that's still used. It's not a common method, but it is still used. The issues with peri-areolar is that you have to cut through breast tissue. Breast tissue can contain bacteria, and the worry there is that by the insertion of the implant through a peri-areolar scar is that bacteria can end up on top of the implant. So it's a method now that's less in favor, and it's the IMF incision that's more in favor. The axillary scar is typically not used in Australia. It's again an older method. Most people have moved towards an IMF just for better control of the pocket for the implant. It's very popular in Asia, particularly Korea, where there's a thought that we don't want any scars around the breast. But again, that is a method that they still use, but we don't tend to use it in Australia very often. I would say 100% of the implants that I've put in would be an IMF incision, or an incision along the breast fold. As I say, it heals very well. It's easy to control the IMF fold itself. There's no issues with the scar itself. Tends to hide very well long term, and it's just a trouble-free area for incisions.